Here's the translation of your text into English. Imagine a battlefield on the alluvial plains of Mesopotamia, some 4,500 years ago, where the sun blazes like a divine furnace, the air is thick with dust that clings to sweaty skin, the metallic scent of blood mingles with the stench of bodies and horse manure, and a Sumerian warrior, with a bronze spear embedded in his abdomen, crawls among corpses toward a physician priest. The priest, clad in a sweat-soaked linen robe, holds a flint knife in one hand and a clay bowl filled with crushed herbs in the other, murmuring prayers to Enki, the god of wisdom, while deciding whether to cut, stitch, or simply commend the soldier's soul to the gods of the underworld. Thus begins our odyssey through the history of treating war wounds, a monumental tale that takes us from the sticky ointments of antiquity, applied with more faith than science, to the blood transfusions on the beaches of Normandy, where modern science began to triumph over chaos. This is not a mere recounting of rusty scalpels, makeshift bandages, or remedies that would make us shudder today. It is a deep dive into the heart of the battlefield, where doctors, soldiers, nurses, healers, and even desperate civilians fought death with primitive tools, wild ideas, and a courage that sometimes bordered on madness. We will explore every era, every type of wound, every instrument, every remedy, every colossal mistake, every miraculous advance, and every human story with a depth that will make you feel the edge of a sword, smell the stale antiseptic, hear the cries of the wounded, taste the dust of combat, and sometimes laugh at the irony of the absurd attempts to save lives in the midst of hell. Prepare for an extensive journey, as we will unearth every detail, from the dung poultices of Sumeria to the mobile operating theaters of World War II, with a narrative that will take you to the edge of chaos, hope, and human resilience. In Mesopotamia, where wars between city-states like Uruk, Lagash, and Kish were as frequent as the floods of the Tigris and Euphrates, war wounds were a catalogue of horrors that defied the imagination. Bronze swords, sharp but brittle, could inflict deep cuts that severed muscles, tendons, or arteries, leaving a soldier bleeding out in minutes in the scorching dust. Spears, tipped with bronze, stone, or flint, pierced the abdomen, lungs, or liver, causing internal hemorrhages that were almost always fatal, especially if the tip broke inside the body, a common issue with brittle flint. Maces, designed to crush, turned bones into splinters, leaving limbs mangled like torn rags. Arrows, tipped with flint, obsidian, or bronze, embedded themselves in tissues, often with barbs that made extraction a surgical nightmare. Physicians, often priests in linen robes with braided beards, worked in conditions that would make any modern surgeon blanch. They washed wounds with water, beer, or, in a twist that makes us cringe today, urine, which, though repulsive, was more sterile than river water contaminated with human and animal waste, manure, sediments, and parasites like protozoa. Then they applied ointments made from crushed herbs, barley, cumin, coriander, garlic, onion, parsley, or tamarind, mixed with honey, clay, tree resins like cedar, or, in a mistake that likely killed more than it saved, dried manure, believed to have healing properties due to its supposed vital energy. Honey was a fortunate choice, as its natural antibacterial properties, derived from its high sugar content, low water content, and production of hydrogen peroxide, inhibited the growth of bacteria like Staphylococcus aureus or Streptococcus pyogenes. But manure, teeming with anaerobic bacteria like Clostridium tetani, causing tetanus, or Clostridium perfringens, responsible for gas gangrene, was a recipe for disaster, turning superficial wounds into deadly traps. Bandages, made of linen, papyrus, or plant fibers like hemp, were applied carefully, often soaked in the same ointments, but the lack of hygiene made infections like sepsis a death sentence for many. If a wound began to ooze, turned green, or the soldier delirious with fever, the physician-priest might resort to incantations, waving clay amulets inscribed with cuneiform symbols or reciting hymns to ward off the demons believed to cause infections. This didn't heal, but it at least calmed the nerves of the patient and those around them, because in a world without antibiotics, faith was as crucial as physical treatment. Soldiers who survived did so through sheer endurance, luck, or because the wound was superficial, but scars, disabilities, or chronic infections, like abscesses that could fester for years, were the price of staying alive. A warrior with an amputated leg could consider himself lucky to return to his village, though he would likely spend the rest of his life begging or relying on his family in a society where physical strength was the currency of survival. In Egypt, military medicine took a step forward, thanks to a society obsessed with organization, writing, and the cult of eternal life, which, paradoxically, also applied to saving lives in the present. The Egyptians, who faced conflicts with the Hyksos, Nubians, or desert tribes, left documents like the Edwin Smith Papyrus, written around 1600 BCE, which describes 48 cases of injuries, many related to war wounds, with an approach so rational it feels almost modern. If a soldier arrived with a gash in the arm, caused by a Kapesh sword, a curved bronze blade that could cut like a primitive guillotine, or a war axe, physicians cleaned it with boiled water or beer, which was safer than Nile water infested with parasites like schistosomiasis, sediments, and bacteria like Escherichia coli. They then closed the wound with sutures of linen thread, abundant in Egypt thanks to its massive cultivation in the fertile delta, or animal tendons from sheep, goats, or cows, using needles made of bone, bronze, or hardened acacia thorns, which could pierce skin with surprising precision. These sutures weren't as precise as modern ones, but they could hold wound edges together, giving the body a chance to heal through scar tissue formation. They also used linen bandages soaked in ointments of resins, like myrrh or frankincense, which had anti-inflammatory and antiseptic properties, or minerals like copper, lead, antimony, or iron oxide, which acted as barriers against infections. Copper, by the way, has antimicrobial properties because its ions damage bacterial cell membranes, a detail the Egyptians applied without understanding the chemistry but with decent results for superficial wounds. Open fractures, where the bone pierced the skin, were a serious problem, especially in battles against the Hyksos, whose war chariots could crush limbs. Physicians tried to align the bone by hand, a process so painful it must have made even the bravest pharaoh scream, and used wooden splints, palm bark, resin-hardened papyrus, or split reeds to immobilize the limb, creating a primitive cast that, at best, kept bones in place while they healed. If the wound showed signs of infection, pus, foul odor, redness, or high fever, amputation was the only option. These were performed with flint, obsidian, or bronze knives, without anesthesia beyond a gulp of strong wine, a mandrake infusion, whose root contained alkaloids that could sedate but also be poisonous in excess, or a blow to the head to stun the patient, a method that, while effective at calming them, could cause concussions or skull fractures. Imagine the scene: a soldier screaming, a physician sawing with a tool that looks like it came from an archaeological dig, and an assistant holding the patient still, all while desert dust sticks to blood and sweat, and the smell of burnt flesh fills the air if cauterization was used. Survival rates were low, and those who survived often did so with chronic infections like osteomyelitis, permanent disabilities, or an epic tale to tell, if anyone believed them in a society that valued strength and saw weakness as a curse. The Greeks, with their intellectual arrogance and love for philosophy, took military medicine to a new level, especially during wars against the Persians, such as the battles of Marathon, 490 BCE, Thermopylae, 480 BCE, or Salamis, or internal conflicts between city-states like Athens and Sparta in the Peloponnesian War, 431 to 404 BCE. Hippocrates, known as the father of medicine, left treatises showing how Greek physicians treated battlefield wounds, combining empirical observation with ideas that, while ingenious, were sometimes more poetic than practical. Their approach was limited by the theory of the four humors: blood, phlegm, yellow bile, and black bile, which held that health depended on a balance of these fluids, an idea that dominated medicine for centuries and led to treatments as absurd as they were brilliant. If a hoplite arrived with a spear wound, caused by a bronze-tipped dory, physicians washed it with wine or vinegar, leveraging the disinfectant properties of alcohol and acetic acid, which could kill bacteria like Staphylococcus aureus or Pseudomonas aeruginosa. They then applied bandages with oils, like olive oil, abundant in Greece thanks to its olive groves, mixed with herbs such as myrrh, thyme, rosemary, sage, oregano, mint, or pine resin, which reduced inflammation and, in some cases, had antibacterial effects thanks to compounds like thymol, carvacrol, or terpenes. Hippocrates insisted that wounds be kept clean and dry, a crucial advance, as many of his contemporaries believed pus, which they called laudable pus, was a sign of healing, when in reality it was a breeding ground for bacteria like Streptococcus pyogenes, which caused deadly infections like necrotizing fasciitis. But not everything was sensible. If a physician believed the wound was caused by an imbalance of humors, they might perform bloodletting, cutting a vein or artery with a knife or lancet to release excess blood, a procedure that could further weaken a soldier who had already lost half a liter in battle, leading to hypovolemic shock or death. Arrow wounds were a headache, especially against Persian archers, whose barbed arrows were designed to be difficult to remove. The Greeks used metal, bone, or wooden probes to gauge the arrow's depth and decide if it could be extracted. If the tip was barbed, physicians might use a tool resembling pincers, a spoon, or a hooked probe to open the wound and remove the tip, but without anesthesia, the patient had to bite down on a piece of leather, wood, or even a branch to endure the pain, which must have felt like a scorpion tearing out their soul. If the arrow was near a vital organ, like the heart, lungs, or liver, they sometimes chose to leave it in, hoping the body would encapsulate it in scar tissue, though this often led to chronic infections, abscesses, or a slow, painful death by septicemia. The Romans, with their obsession with discipline, logistics, and conquest, took military medicine to a level of organization that would have made the Greeks blush. Their armies included specialized physicians, the Medici, who were part of the legions and trained to treat wounds on the battlefield, whether during the conquests of Gaul, like the Battle of Alesia, 52 BCE, in Britannia against Boudicca's Celts, or in wars against the Parthians in the east, like the disastrous campaign of Carrhae, 53 BCE. They built field hospitals called valetudinaria, permanent structures in military camps with wards for the wounded, medical supply stores, drainage systems for hygiene, and, in some cases, underfloor heating powered by subterranean furnaces, a luxury many modern hospitals would envy. These weren't hospitals with beeping machines and rushing nurses, but they were a huge leap forward compared to the makeshift tents of other civilizations, which often flooded in the rain or swarmed with flies. The Romans used surgical tools made of bronze or iron, such as curved blade scalpels, pointed probes, hooks, pincers, bone saws, retractors, and forceps, found in archaeological digs in places like Pompeii, Vindolanda, or the legionary camp at Xanten, and which look like props from a horror movie due to their crude but functional design. If a legionary arrived with a deep wound, caused by a gladius sword, a pilum spear, or a Parthian arrow, physicians could cauterize it with a red-hot iron, a method that stopped bleeding by searing blood vessels and, with luck, prevented infections, though the pain was unbearable, and many died from shock due to the trauma. They also used sutures, sometimes with linen thread, silk imported from the East, animal tendons, or horsehair, and in advanced cases, metal staples of bronze or iron that functioned as primitive versions of modern surgical staples, closing large wounds with surprising precision for the era. One of the most interesting tools was the diacal spoon, designed specifically to extract arrowheads. This curved instrument allowed physicians to surround the arrowhead and remove it without tearing more tissue, though it required surgical skill not all physicians possessed, especially in the chaos of a battle where the ground shook with cavalry charges and the air was filled with screams and dust. The Romans also used herbal ointments, like garlic, onion, rosemary, thyme, myrrh, frankincense, pine resin, or Judean balsam, and linen bandages to protect wounds, often soaked in wine, vinegar, or honey to leverage their antiseptic properties. However, the lack of knowledge about infections meant many wounds became complicated, and gangrene, caused by bacteria like Clostridium perfringens, was a constant threat. Roman physicians also performed trepanations, drilling the skull with a hand-operated wooden or metal drill to treat head wounds, skull fractures, or relieve brain pressure caused by subdural hematomas, a procedure that, surprisingly, had a decent survival rate if done carefully and the patient didn't succumb to a later infection, like bacterial meningitis, which could kill in days. The Middle Ages were, in many ways, a step backward from military medicine, as if humanity had decided to forget everything the Romans had learned and revert to a world where faith and superstition trumped reason. Wars, with their armored knights, archers, spearmen, infantry, and later, primitive firearms like arquebus, produced increasingly complex wounds. Long swords, great swords, and lances caused deep cuts that could sever muscles, tendons, or arteries. Arrows, shot by English longbows or Genoese crossbows, pierced tissues and organs, often leaving embedded tips. maces, war hammers, and clubs shattered bones like dry branches, and early firearms, used in battles like Agincourt, 1415, Crécy, 1346, or the Siege of Constantinople, 1453, left irregular wounds filled with metal fragments, clothing, gunpowder, and dirt. Surgeons, who were often barbers, yes, the same ones who cut your hair, shaved you, or pulled a tooth with the same tool they used to amputate, worked in appalling conditions. Battles, like those of the 100 Years' War or the Crusades, left fields strewn with wounded, and surgeons operated in makeshift tents, often under rain, mud, or dust, with tools that were rarely cleaned and no concept of sterility. A stab wound might be cleaned with wine, vinegar, or boiled water, which wasn't bad for the time, but infections were inevitable. Without antibiotics, a small cut could become a nightmare, with pus, fever, and, in the worst cases, gangrene, known as hospital fire, for its ability to spread like wildfire through tissues. Gangrene was so common that soldiers feared it more than battle, as the only solution was amputation. Amputations were done with bone saws, without anesthesia, while the patient bit down on a piece of leather, wood, or a stick that others had used, which didn't help prevent infections since these objects were teeming with bacteria. Surgeons also used cauterization, burning wounds with red-hot irons heated in braziers or pouring hot pitch, a method that stopped bleeding by sealing blood vessels but could cause severe burns, secondary infections, and pain so intense that soldiers would rather face the enemy again than go through the makeshift operating theater. In this era, a key figure emerges. Ambroise Paré, a 16th-century French surgeon who revolutionized military medicine with a mix of pragmatism, curiosity, and humanity. Paré began as a barber-surgeon, a humble trade combining haircuts with rudimentary surgeries, but his experiences in the Italian wars, such as the Siege of Turin, 1536, or the Battle of Hesdin, 1553, led him to question the methods of his time. Gunshot wounds, increasingly common with arquebus and muskets, were considered poisonous due to the gunpowder, and the standard treatment was to pour boiling oil into the wound to burn out the poison. Imagine the pain. First, you're shot, then they pour 200-degree oil on you, like frying in hell. Paré, unconvinced about torturing his patients, discovered by chance that wounds treated with an ointment of egg yolk, rose oil, and turpentine healed better than with boiling oil. This happened when, during a battle, he ran out of oil and had to improvise with what was at hand. The next day, he noticed that soldiers treated with the ointment were more comfortable, with less fever, less inflammation, and fewer infections. Paré also improved amputations, using ligatures to tie arteries and control bleeding instead of cauterizing everything with a hot iron, reducing pain and improving survival rates. He used forceps to grasp arteries and tied them with linen or silk thread, a technique requiring precision but avoiding the severe burns of cauterization. He also designed rudimentary prosthetics, like wooden legs with leather or metal joints or iron hands that could hold objects, allowing some soldiers to return to a semi-normal life, though walking with a wooden leg in the mud of a camp wasn't exactly a stroll along the Seine. He wasn't perfect. He believed in odd ideas, like sympathetic powders, that supposedly healed wounds by applying them to the weapon that caused them, a practice that seems more like magic than medicine today. But his innovations saved countless lives and laid the foundation for modern surgery, showing that ingenuity could triumph over brutality. In the 17th and 18th centuries, wars grew larger, more organized, and more destructive, with massive armies and weapons that made wounds increasingly devastating. Muskets, cannons, grenades, bayonets, and early pistols produced injuries that made swords and spears seem like toys. Musket balls, large and heavy, shredded tissues, shattered bones, and left fragments of lead, clothing, gunpowder, and dirt inside the body, creating a breeding ground for infections like sepsis or tetanus. Surgeons worked in precarious conditions, in tents surrounded by mud, blood, and the constant sound of gunfire, or on the lower deck of a warship, known as the orlop, a hellhole filled with blood, screams, the smell of gunpowder, sea salt, and the ships rocking, as in the Battle of Trafalgar, 1805, where British and French naval surgeons operated under the roar of cannons. If a sailor was shot or had a leg pierced by a wooden splinter, common on wooden ships bombarded by cannonballs, as a cannonball could send splinters flying like shrapnel, the surgeon had to decide quickly. amputate or try to save the limb. Amputation was the most common choice, as it was quick and increased survival chances in an environment where infections were nearly inevitable. Without anesthesia, the patient relied on a swig of rum, brandy, gin, whiskey, or a dose of opium, which could dull the pain but also cause addiction or overdose. Tourniquets, made of leather, cloth, rope, or belt straps, were used to control bleeding, but if left on too long, they could cut off circulation and cause gangrene, a problem surgeons knew about but couldn't always avoid in the chaos of battle. Bandages, when available, weren't always clean, and surgeons used the same instruments on multiple patients without washing them, spreading infections like sepsis, tetanus, or puerperal fever, which could kill in days. Naval surgeons faced unique challenges, especially in naval battles like Lepanto, 1571, or Trafalgar. On a warship, space was limited, and wounds were often caused by wooden splinters, as lethal as bullets. A cannonball hitting the hull could send splinters flying like shrapnel, piercing sailors and leaving irregular wounds filled with wood fragments, salt, paint, tar, and dirt. These splinters were a breeding ground for infections, as wood, being organic, carried bacteria like Clostridium or Pseudomonas. Surgeons had to work quickly, operating on makeshift tables that rocked with the ship's movement, often lit only by candles or lanterns that could go out with a wave. They used bone saws, scalpels, forceps, and probes stored in wooden boxes that looked more like carpentry kits than medical equipment. For superficial wounds, they applied herbal ointments like rosemary, thyme, sage, or myrrh, resins, mercury, which, though toxic, was believed to be healing due to its silvery shine, or beeswax, which sealed the wound but didn't always prevent infections. For severe wounds, amputation was almost always the answer, and naval surgeons were famous for their speed, capable of cutting off a leg in under 2 minutes, a record that saved lives but didn't ease the patient's suffering, who often fainted from pain or died of shock. Sailors who survived often died days later from infections, hemorrhagic shock, or complications like tetanus, as blood transfusions didn't exist, and hygiene was practically non-existent, with seawater often used to wash wounds, adding irritation and more bacteria. In the 19th century, things began to improve, though not as much as you might think, as medicine was still caught between tradition and emerging science. The Napoleonic Wars, 1803 to 1815, and the American Civil War, 1861 to 1865, were a turning point, not because medicine was much better, but because the scale of the conflicts, with armies of hundreds of thousands, forced doctors to organize like never before. Field hospitals became more common, often set up in churches, barns, schools, or tents, and surgeons began using chloroform and ether as anesthetics, a revolutionary advance. For the first time, a soldier could be unconscious while having a leg amputated, allowing for longer, more precise surgeries. Chloroform, administered with a soaked cloth over the face, was effective but risky, as an overdose could cause nausea, vomiting, respiratory depression, or death. Ether, discovered as an anesthetic in 1846, was safer but had a strong smell and was flammable, making it less practical on the battlefield, especially near candles or kerosene lamps. Infections remained the great enemy. The germ theory, proposed by Louis Pasteur in the 1860s and advanced by Joseph Lister, who introduced antiseptics like carbolic acid, wasn't yet widely accepted, and surgeons operated with dirty hands, using the same instruments on multiple patients without sterilizing them. In the American Civil War, it's estimated that up to 50% of soldiers who survived an amputation later died from sepsis, gangrene, or puerperal fever, a bacterial infection spread in hospitals due to poor hygiene. Bone saws, the star tool for amputations, were passed from one patient to another without cleaning, accumulating blood, tissue, and bacteria, and the sponges used to clean wounds were reused until they were black, becoming a vector for infections like streptococcus or staphylococcus. Dominique Larrey, Napoleon's chief surgeon, was a pioneer in this era, not only for his surgical skills but for his logistical vision. He created the first flying ambulances, horse-drawn carriages designed to transport the wounded from the battlefield to a hospital as quickly as possible, often in under an hour. These weren't modern ambulances with sirens, oxygen, or defibrillators, but they were a major advance compared to leaving the wounded in the mud until someone picked them up, if anyone did. Larry was also one of the first to practice triage, prioritizing the wounded based on the severity of their injuries, not their military rank. A private with a severe abdominal wound, which could perforate the intestine and cause peritonitis, took precedence over an officer with a superficial cut, something not always well received by generals expecting preferential treatment. Larry was pragmatic. For superficial wounds, he cleaned them with water, alcohol, vinegar, or brandy, which acted as rudimentary disinfectants, and bandaged them with linen or cotton. For severe wounds, like a leg shattered by a cannonball, he amputated without hesitation, using bone saws and ligatures to control bleeding, following Perez techniques. He also developed methods for treating fractures, using wooden or metal splints and bandages, sometimes with primitive plaster made from lime and water, which hardened to immobilize the bone. Thanks to his methods, many Napoleonic soldiers survived wounds that would have been fatal before, though infections remained a constant threat, and many died days or weeks after surgery from sepsis or gangrene. World War I marked a massive leap in military medicine, but also faced brutal challenges due to the scale and ferocity of the conflict, which turned battlefields into industrial slaughterhouses. Trenches, mud, machine guns, shells, grenades, and poisonous gases, like mustard or chlorine, used in battles like Ypres, 1915, or the Somme, 1916, created wounds never seen before. Machine gun bullets, fired by weapons like the Vickers or Maxim, caused multiple wounds, piercing the body in several places with unpredictable trajectories. Shells shredded tissues, bones, and organs, leaving open wounds filled with shrapnel, dirt, uniform fragments, and debris. Grenade fragments could embed anywhere from the skin to the lungs, and poison gases caused chemical burns to the skin and airways, further complicating treatment. The germ theory, proposed by Pasteur and Lister, was now widely accepted, and doctors used antiseptics like iodine, carbolic acid, Dakin solution, sodium hypochlorite, hydrogen peroxide, or diluted chlorine to clean wounds, reducing bacterial loads. Portable X-ray machines, introduced during the war, allowed doctors to locate bullets, shrapnel, or fractured bones with a precision that previously relied on probes and luck. But trench conditions were a breeding ground for infections. The mud was teeming with bacteria like Clostridium perfringens, which caused gas gangrene, an infection that could kill in 48 hours by filling tissues with gas and toxins. Trench fever, a bacterial infection spread by lice, weakened soldiers, making them more vulnerable to wounds. Surgeons developed advanced techniques, like debridement, which involved cutting away all dead, infected, or damaged tissue to prevent the spread of infection, a long, painful, and sometimes repetitive process, as wounds could reinfect within hours. They also used irrigations with saline, antiseptic solutions, or sterile water, often with improvised hoses, large syringes, or perforated bottles. Blood transfusions, still primitive, began to be used for soldiers in hemorrhagic shock, but the lack of knowledge about blood types, discovered by Karl Landsteiner in 1901, made many transfusions risky, with patients dying from incompatible reactions causing hemolysis or kidney failure. Field hospitals were better organized, with triage teams sorting the wounded into 3 categories: those who could be saved with immediate treatment, those likely to die, and those who could wait. This saved more lives, but doctors worked under immense pressure, with 24 or 36-hour shifts, limited resources, the constant sound of bombardments, and the smell of blood, mud, antiseptics, and burnt flesh permeating the air. World War II brought advances that changed military medicine forever, marking the dawn of the modern era of trauma surgery. Penicillin, discovered by Alexander Fleming in 1928 and mass-produced during the war thanks to scientists like Howard Florey and Ernst Chain, was a game-changer. For the first time, doctors could combat bacterial infections like sepsis, gangrene, and tetanus with an effective drug, drastically reducing deaths from infections. Penicillin was administered as a powder sprinkled directly on wounds, in intramuscular injections, or in ointments, and soldiers carried it in first aid kits, often applying it themselves before reaching a hospital. War wounds were more devastating than ever, with tanks, air bombardments, machine guns, mortars, and mines causing multiple injuries, burns, open fractures, and wounds filled with shrapnel, dirt, debris, and uniform fragments. Field hospitals, now more advanced, had electric generators, portable X-ray machines, mobile surgical units mounted on trucks or reinforced tents, and blood transfusion units. Understanding blood types, thanks to Landsteiner's work, allowed safer transfusions, and dried plasma, which could be stored and transported without refrigeration, saved thousands of soldiers in hemorrhagic shock, especially in battles like Stalingrad, 1942 to 1943, Normandy, 1944, or Iwo Jima, 1945. Mobile Army Surgical Hospitals, MASH units, introduced in World War II and perfected in the Korean War, brought surgery to the front, allowing treatment of the wounded within hours, sometimes minutes, of injury. Surgeons used refined debridement techniques, cutting away dead tissue with sterile scalpels and irrigating with antiseptic solutions like Dakins or chlorhexidine. Sutures were more precise, using sterile cotton, linen, or catgut, made from sheep intestines, thread and curved surgical needles that allowed almost artistic wound closure. Anesthesia, with ether, chloroform, or sodium pentothal, enabled longer, more complex surgeries, like vascular reconstruction, fracture fixation with metal plates and screws, or repair of perforated organs like the liver or intestines. However, the volume of wounded in battles like Stalingrad, where house-to-house fighting left hundreds of thousands injured, or D-Day in Normandy, where beaches were littered with bodies mangled by mines and machine guns, overwhelmed doctors, who worked to exhaustion, making life-or-death decisions in seconds as planes roared and explosions shook the ground. Explosive wounds were particularly brutal and deserve detailed analysis because they reveal the horror of modern warfare. A shell, landmine, or grenade could tear off limbs, shred organs, or cause severe burns, often leaving open wounds filled with dirt, metal, wood, cloth, and debris. These wounds, known as blast injuries, could cause multiple types of damage. The shock wave could fracture bones without breaking the skin, damage internal organs like the lungs or brain from pressure, and embedded particles acted as a breeding ground for bacteria. Surgeons used forceps, probes, and X-rays to extract shrapnel, but some wounds were so extensive that amputation remained the quickest and safest option, especially on the front, where time was critical. Gas gangrene, though less common thanks to penicillin, remained a threat in deep wounds where anaerobic bacteria thrived, producing gas and toxins that could kill in hours. Doctors fought these infections with aggressive debridement, cutting away all affected tissue, and with penicillin or sulfa drug injections, also used in powders or ointments. Burns, caused by flamethrowers, incendiary bombs, napalm, or burning tanks, were another challenge. Doctors applied ointments like Vaseline with sulfa drugs to reduce infections, wet saline bandages to keep the skin hydrated, or, in desperate cases, pigskin or wax bandages to protect wounds and prevent fluid loss. Plastic surgery, still in its infancy, began to be used to reconstruct disfigured faces and limbs, with pioneers like Archibald McIndoe, who worked with RAF pilots burned in the Battle of Britain, 1940, developing skin graft techniques that not only saved lives but restored dignity to the wounded, laying the foundation for modern reconstructive surgery. The role of women in military medicine is a chapter that deserves special focus, as their contributions, often overlooked by history books, were crucial in every era. In antiquity, women were rarely recognized as physicians, but in many cultures, like Egypt, Greece, or Mesopotamia, healers, midwives, and priestesses assisted in treating the wounded, especially in communities where men were at the front. In Egypt, women in the temples of Hathor or Isis used their herbal knowledge to prepare ointments and poultices, while in Greece, followers of Asclepius, the god of medicine, helped in healing sanctuaries, applying bandages and comforting the wounded. In the Middle Ages, nuns in monasteries, like those of the Order of Saint Benedict, cared for wounded soldiers during the Crusades, using their herb gardens to prepare remedies with plants like sage, thyme, lavender, chamomile, comfrey, plantain, or yarrow, which had anti-inflammatory, antiseptic, or analgesic properties. During the Crusades, women like the Hospitallers of the Order of St. John tended to crusaders in the Holy Land, cleaning wounds, applying bandages, and offering psychological comfort, which was as vital as physical treatment, as a soldier who believed he would survive was more likely to do so. In the 19th century, figures like Florence Nightingale revolutionized military nursing during the Crimean War, 1853 to 1856, insisting on hygiene, ventilation, and hospital organization, reducing mortality rates from infections from over 40% to under 2% in some hospitals. Nightingale wasn't a surgeon, but her work in cleaning wards, washing bandages, and training professional nurses saved more lives than many scalpels, and her legacy inspired the creation of the Red Cross by Henry Dunant after the Battle of Solferino, 1859. In World War I, nurses worked in hellish conditions, assisting in surgeries, administering antiseptics like iodine or Dakin solution, and comforting the wounded, often under bombardment or in field hospitals infested with rats and lice. In World War II, combat nurses, like those in MASH units, operated near the front, managing transfusions, applying penicillin, performing triage, and sometimes assisting in surgeries under enemy fire, as in the Battle of Anzio, 1944. These women, often ignored by official history, were essential to the advancement of military medicine, bringing not only technical skills but also empathy, organization, and a calm that kept medical teams afloat amid the chaos. The psychological impact of war wounds is another crucial aspect often overlooked but as debilitating as physical injuries. In antiquity, pain, fear, and trauma could be lethal. Physicians used opium, mandrake, hemp, or henbane to calm patients, but dosages were a guessing game, and an overdose could cause respiratory depression or death. In Mesopotamia, soldiers might receive poppy infusions containing natural opioids, while in Egypt, mandrake or blue lotus were used as sedatives, though with risks of intoxication. In the Middle Ages, alcohol was the most common anesthetic, and it wasn't rare for a drunken soldier to be operated on while singing, cursing, or screaming until fainting. In the 19th century, chloroform and ether allowed patients to sleep during surgery, but side effects like nausea, vomiting, or respiratory depression were risky, and surgeons had to calculate doses carefully, a challenge in the chaos of battle. In World War I, doctors began noticing shell shock, what we now call post-traumatic stress disorder, PTSD. Soldiers suffered nightmares, tremors, anxiety, insomnia, psychogenic paralysis, or mutism, and doctors, lacking modern psychological knowledge, treated them with rest, alcohol, opiates, hypnosis, or electric shocks, a method that seems barbaric today but was considered innovative, based on the idea of reactivating nerves. In World War II, recognition of PTSD advanced, and doctors began using group therapy, sedatives like barbiturates, or hypnosis to treat traumatized soldiers, with mixed results. Psychological trauma didn't just affect the wounded but also surgeons and nurses, who faced the stress of operating under pressure, making life or death decisions, and seeing patients die daily, often developing symptoms of burnout or what we now call secondary traumatic stress. Logistical advances were another pillar of military medicine, as saving a life depended as much on reaching the wounded in time as on treating them correctly. In antiquity, the wounded often died on the field because there was no way to transport them quickly. The Romans were the first to organize evacuation systems, carrying the wounded to valetudinaria in mule-drawn carts or litters carried by slaves or soldiers. In the Middle Ages, evacuation was chaotic, and many soldiers were abandoned on the field until the battle ended, if anyone retrieved them. Larry's flying ambulances in the 19th century were a revolutionary advance, allowing the wounded to reach field hospitals in hours, not days, using lightweight carriages designed to move quickly even on rough terrain. In World War I, trains and ambulance trucks improved evacuation, transporting hundreds of wounded from the front to rear hospitals, as in the Battle of Verdun, 1916. In World War II, jeeps, helicopters, and medicalized planes, like adapted C-47s, allowed the wounded to reach hospitals in minutes, especially in operations like the Normandy landings, where the injured were evacuated from beaches to hospital ships or bases in England. These logistical advances not only saved lives but also allowed surgeons to treat fresh wounds before infections like gangrene or sepsis set in. The influence of military medicine on civilian medicine is another fascinating aspect, as many techniques developed under enemy fire transformed hospitals in peacetime. The Egyptians' linen sutures became a standard for closing wounds, used until the 19th century. Paris ligatures for controlling bleeding were adopted in civilian surgery, reducing reliance on cauterization, which was brutal and imprecise. Lister's antiseptics, tested in military hospitals during the Franco-Prussian War, 1870 to 1871, revolutionized civilian surgery, reducing postoperative infections from over 50% to under 15% in some hospitals. Penicillin, mass-produced during World War II, became a cornerstone of modern medicine, saving millions of lives in peacetime by treating infections like pneumonia, syphilis, or meningitis. MASH units inspired modern emergency response systems, like ambulance services, trauma teams, and mobile hospitals used in natural disasters. Even plastic surgery, developed to treat burns and facial wounds in World War II, became a civilian specialty, covering everything from reconstructions for accident victims to cosmetic procedures like implants or facelifts. Let's now delve into the technical details of wounds and their treatment in each era, as the small nuances reveal how ingenious or disastrous military medicine could be. Arrow wounds were a nightmare in antiquity and the Middle Ages, as they not only pierced but often remained embedded, and extracting them without causing further damage was an art. The Greeks and Romans used metal, bone, or wooden probes to gauge the arrow's depth, often probing blindly in bleeding tissues. If the tip was barbed, like those used by Persian, Parthian, or English longbow archers in battles like Agincourt, surgeons used pincers, spoons, or hooked probes, but without anesthesia, the patient had to bite down on a piece of leather, wood, or even a broken arrow to endure the pain, which must have felt like having their soul ripped out with pliers. If the arrow was near a vital organ, like the heart or lungs, it was sometimes left in, hoping the body would encapsulate it in scar tissue, though this led to chronic infections, abscesses, or a slow death by septicemia. In the Middle Ages, some desperate surgeons pushed the arrow through the other side of the body to extract it, a brutal method that avoided the barbs but could pierce organs or cause massive bleeding, especially if the arrow passed through the abdomen, where the intestine could rupture and release bacteria like Escherichia coli into the peritoneal cavity. Sword or spear wounds, common in all eras, posed the problem of bleeding, which could be fatal in minutes if they hit a major artery like the femoral, brachial, or carotid. In antiquity, physicians pressed the wound with a cloth, sponge, clean dirt, or sphagnum moss, which absorbed blood and, in the case of moss, had antiseptic properties thanks to its phenolic compounds. They used makeshift tourniquets, like ropes, cloth strips, leather straps, or twisted branches, but if left on too long, these could cut off circulation and cause gangrene or ischemia. The Romans used cauterization with red-hot irons, heated in braziers until glowing, an effective method for sealing blood vessels but brutal for the patient, who often died from shock due to pain or from secondary burns that became infected. In the Middle Ages, some surgeons experimented with ligatures, tying arteries with linen, silk, or horsehair thread, but this required precision, which was difficult in the chaos of a battle where the ground was covered in blood and mud. Pear perfected this technique in the 16th century, using forceps to grasp arteries before tying them, reducing deaths from hemorrhage and laying the foundation for modern vascular surgery. In the 19th century, with anesthetics like chloroform, surgeons could take more time to tie blood vessels, using sterile thread and finer curved needles, but infections remained a problem until Lister's antiseptics allowed for cleaner surgical environments. Fractures, especially open ones, were another challenge that could turn an injury into a death sentence. A leg broken by a mace, horse, cannonball, or shell could expose the bone to air, inviting bacteria like Clostridium or Staphylococcus. In antiquity, physicians aligned bones by hand, a process so painful it required tying the patient down or having multiple assistants hold them, and used wooden, metal, tree bark, or resin-hardened papyrus splints to immobilize the limb. The Egyptians were particularly skilled, creating primitive casts with linen bandages soaked in resin or natural plaster, which hardened to keep bones in place. In the Middle Ages, open fractures were almost always fatal, as exposure to air, mud, and dirt guaranteed infection. Surgeons cleaned the wound with wine, boiled water, vinegar, or, echoing antiquity, urine, still used for its supposed sterility, and aligned the bone, but without antibiotics. The outcome depended on luck or the patient's resilience. In the 19th century, anesthetics allowed for more careful bone alignment, using plaster of Paris, a calcium sulfate mixture that hardened quickly, providing more effective immobilization. In World War II, stainless steel plates and screws allowed for surgical fracture fixation with precision that prevented deformities, and penicillin reduced infections, though open fractures remained a challenge, especially in wounds contaminated by shrapnel or dirt. Gunshot wounds, common since the 15th century with the introduction of arquebus, muskets, and cannons, brought a new level of complexity that changed military medicine forever. Heavy, deformable lead bullets shredded tissues, shattered bones, and left fragments of metal, clothing, gunpowder, and dirt inside the body, creating a breeding ground for infections like sepsis, tetanus, or gangrene. In the 17th and 18th centuries, surgeons used metal, wooden, or even their own fingers to probe for the bullet, a process that often worsened infections by introducing more bacteria. The idea that gunshot wounds were poisonous, due to gunpowder or lead, persisted until the 16th century, and treatments like boiling oil, hot pitch, or mercury, which caused heavy metal poisoning, were cruel and ineffective. Pear showed that cleaning the wound with water, wine, alcohol, or vinegar and carefully extracting the bullet was more effective, though still risky without anesthesia. In the 19th century, X-rays, discovered by Wilhelm Röntgen in 1895, allowed for precise location of bullets and shrapnel, reducing the need for invasive probes. In World War I, gunshot wounds reached a new level of devastation, with machine gun bullets, shells, and grenades causing multiple injuries that could pierce several organs at once. Surgeons used debridement, irrigations with antiseptic solutions, and sutures, but without antibiotics, many wounds remained fatal, with infection mortality rates near 30% in some field hospitals. In World War II, penicillin and advanced surgical techniques, like vascular reconstruction, which allowed repairing damaged arteries instead of amputating, saved thousands of soldiers, though multiple wounds remained a challenge in battles like Kursk, 1943, or Bastogne, 1944. Natural remedies were a constant across all eras, as in a world without pharmaceutical labs, plants and natural materials were the only pharmacy available. In antiquity, the Romans used garlic, onion, honey, resins, thyme, rosemary, sage, myrrh, and frankincense, which have antibacterial properties thanks to compounds like allicin, terpenes, or polyphenol. They also used sphagnum moss, which absorbed blood like a sponge and had antiseptic properties due to its polysaccharides, or willow bark, which contains salicin, a natural precursor to aspirin that relieved pain and fever. In the Middle Ages, monks cultivated herb gardens in monasteries, with plants like sage, thyme, lavender, chamomile, comfrey, plantain, yarrow, rue, or St. John's wort, used in ointments, poultices, infusions, or plasters to treat wounds, reduce inflammation, or relieve pain. In the American Civil War, Confederates, with limited supplies due to the Union blockade, used echinacea, willow bark, sphagnum moss, comfrey root, elderberry, or agrimony, which had antiseptic, astringent, or analgesic properties. These remedies weren't always effective, and some, like henbane or hemlock, could be poisonous if misused. But in a world without antibiotics, anything that offered hope was welcome, and soldiers often trusted a monk's yarrow more than a barber-surgeon's scalpel. In summary, treating war wounds was a mix of courage, improvisation, ingenuity, faith, desperation, and luck. From the honey in Mesopotamia, which prevented infections by pure chemical chance, to the penicillin of World War II, which marked the dawn of modern medicine, doctors did their best with what they had, facing infections, hemorrhages, psychological trauma, and the chaos of the battlefield. Each era brought advances, from the Egyptians' linen sutures to MASH units, but also absurd mistakes, like bloodletting that killed more than it cured, boiling oil that tortured the wounded, or the idea that pus was a sign of healing. The history of military medicine is a testament to human ingenuity, the resilience of soldiers, and the tenacity of those who, in the midst of hell, tried to snatch lives from the jaws of death, leaving a legacy that continues to save lives today.